A deadly epidemic is now being called a serious threat to regional security in Western Africa. The outbreak of suspected Ebola virus has already killed 70 people in Guinea, and it is spreading. The highly contagious virus, which causes uncontrollable bleeding and quick death, has spread from the countryside to the capital, a city of 2 million people. Tarek Yassarevich is with the World Health Organization. He's joining me now from the capital of Guinea, Conakry. Thank you so much for joining us. So tell us, what are you with the World Health Organization and authorities doing to stop this disease?
Thank you very much, Yalitza, for having me in your program. The World Health Organization is basically supporting the national health authorities here in Guinea to put in place all necessary measures that we know can be helpful in preventing the spread. This includes clinical management of cases, so basically taking good care of those who have been infected, dealing with those who have been infected in a way that the virus is not transmitted to health workers and to the families. This involves putting up isolation wards and facilities. It also includes stepping up lab facilities, so we are able to test samples very fast. But also it involves information provided to the population and to the health workers. Guinea has not been facing Ebola before. This is the first time. People don't know about it much, and health workers do not know much about it either. So we really need to provide this information out, and we are working really around the clock here with the Ministry of Health and other partners to do those measures.
But despite what you're doing, Mr. Yassarevich, it has spread all the way to Conakry, where you are, a capital, densely populated, and that's 300 kilometers away from the first outbreak.
It is correct. We have so far 8 cases here in Conakry that have been tested positive for Ebola virus. Fortunately, none of those 8 cases have died, but it is showing basically that people have to be careful. What happened basically is that one person from Conakry was traveling to a burial of one of his relatives in a central part of the country and got infected. And this is again why we need to inform the population and tell them about the practices that can increase the risks to get infected, and therefore how they can prevent that risk. And this basically involves not getting in close contact with infected people, not touch body of a deceased person, and basically general hygiene that involves washing hands after seeing people who may have been infected.
Now, it has spread. There have been deaths in neighboring Sierra Leone and Ivory Coast, and now Senegal announced today that it is closing its border. Is that going to help?
Well, while health measures at the borders is an important part in prevention, evidence shows, in fact, that providing a fast response at the source of the outbreak is the best way to ensure maximum protection against international spread of disease. At this point of time, WHO is not recommending any travel restrictions on any of infected countries.
Tarek Yassarevich with the World Health Organization, thank you very much